Today, I'm going to talk a little bit about stage 1 with implants. First of all, we need to understand that this implant, actually, this is a real size of an implant. You can see related to my finger, the size that you have the implant, okay? This is an implant, like if you want to have the idea, this is a 4.2, okay, of diameter times 13. Okay, millimeters. So this is actually the size of a tooth. Okay, so we're gonna place that implant and we're gonna talk about what happens next, because you're gonna have it like bone level. Imagine that this is the bone and this is going to be the level where the implant is gonna be. And then we have here, we have a hexagon that needs to be covered because we don't want to have saliva, or we don't want the gum to grow on top of it. So afterwards, we're going to place this cover screw. Look at the size of the cover screw. This size of the cover screw is going to be a very small diameter. And this is what we're going to do in the mouth. We're going to perform the cover screw, which is going to be tight. The tightening is going to be just with our fingers. This is going to be the cover screw, and now we're done with stage 1. We're gonna wait 3 or 4 months for the osseointegration. Remember that all those threads are gonna be on perfect contact with the bone. Those threads are gonna be in contact with the bone, and we're gonna have also this implant be accepted by the bone. What are we gonna do? After 3 or 4 months, we're gonna just to proceed to open just this area, as you can see here, the area, and we're gonna just remove this cover screw. Once we remove this cover screw, which it takes like 20 minutes to do it, because we're gonna remove it, we're gonna find the same hexagon that is going to be inside the bone, but we're gonna have all the gum already healed. And we're gonna take an impression. We're gonna take an impression of the implant, and we're gonna perform this on the lab. We're gonna do a scan of the implant, and we're gonna perform with an abutment and a crown, which is going to be a stage 2, which I'm gonna show in a moment. After stage 1, where we place the implant, we have the cover screw. We already removed the cover screw. We're not gonna use the cover screw anymore because we're gonna take an impression and we're gonna do the scanning on the lab to perform the crown. When we have the scanner of the implant, we're gonna use an analog, and then we're gonna have the prosthetic work to be done. We're gonna have the abutment, as you can see here. We're going to have the abutment, which is going to connect the crown to the implant. This is the abutment, and this is going to be the crown. Most of the doctors, we prefer to perform crowns with the chimney. This is called a chimney. Why it's called a chimney? Because it has a perforation, which is going to be, there's a screw inside of this. That screw is going to be holding the abutment, as you can see it here. It's going to be holding the crown to the implant. So we perform the new crown. This abutment has a hexagon, a male hexagon, and we have an internal hexagon, as you can see it here. This is going to be connecting first the hexagon, which is going to be an anti-rotational, and we're going to perform obviously a tightening here from the crown to the implant. We're going to put a screwdriver, which is going to be holding to that crown and abutment all the way to the implant. But we need to be sure. We need to be sure that this is going to be really tight. So what we do is that we work with a torquemeter, the same thing that you use, the same principle that you use for, see how it clicks? Okay. This is the way that it works. Okay, once we reach, depending on the brand of the implants, it can be 20 or 30 newtons. Just to have an idea, the strongest man in the world can give you 5 newtons. So you're gonna have a very tight screw attached to the implant through the abutment. So what's going to happen next? So once we have the crown attached to the implant, then probably you're going to say, what's going to happen with that chimney? Are you going to close that chimney? What's going to happen with it? Well, we're going to perform Teflon. Teflon is going to be there, and then we're going to cover this with a special resin. That special resin is going to be the same color as the crown. So probably you're going to see something in a different color here. It's on purpose so we can find it, but it's going to be covered. So there's no food going in. This is going to be connected, and also it's going to be covered. So you're going to have it like a natural tooth. If it's going to be an upper tooth, you're not going to see it unless you open your mouth so big that you see like a different color here. And if it's going to be on lowers, unless you open a lot your mouth, you're going to feel it. This tooth is going to be, or molar, it could be in each case, doesn't matter. It's going to be in contact with occlusion. So you're going to be eating, chewing, grinding, and what might happen? Probably due to the masticatory forces, this screw that you're seeing here might get loose. Yeah, it can happen. What's going to happen? You see the mobility that we have here from the crown? The crown can start to move. Yes, it can happen. Some cases it can happen. Is there a problem with the implant? Not necessarily. It could be only the screw that got loose. Is the end of the world? No, it's not the end of the world. What's going to happen is that you need to reconnect with that screw. So the next step is that you need to come back so we can uncover the chimney. We need to reach the screw again. We need to tighten this. Obviously, mostly of the times we remove the abutment and the crown, as you can see it here. Okay, we remove the abutment and the crown, we give service, we clean the area, we put it back in, and it's the same principle as if you were fixing a tire. Same thing, the nut that goes attached to the car, and this is the tire, same thing. We attach the crown again to the implant, and again you use the torquemeter. Again, you put the torquemeter, you tighten it up, and this is going to be the solution. You put Teflon, you put the resin, and problem solved. How do you know this? Well, unfortunately, you're going to be feeling your crown moving all around, and the doctor is the only one that can tell you if it's the implant or if it's only the screw. But 90% of the cases is going to be the screw. It's a screw going to be broken? Nope. The screw is not good? Nope. So usually it's just the tightening. Why do screws get loose? It can be just due to masticatory forces. Remember what happened to your own teeth. If you destroy your own teeth or you broke your own teeth, that's going to be the same pressure that you're going to be receiving over this tooth. So we need to understand that the magic of implants is not only placing implants, it's also to restore them. What if something goes loose? Well, you just need to tighten it in, close it, and problem solved. I hope this helps, and just to understand that you can do everything perfect, but this is going to be something that is going to be biting and chewing, and we need to understand that masticatory forces are very strong. But if this is your case, it has a solution. Thank you.